Alright, we're going to check for the wrist. The range of motions of the wrist go as the radial deviation, ulnar deviation, flexion, and extension. This allows for our wrist to move and turn around, all that good stuff. Alright, so first to check flexion, we're going to put our axis on the ulnar styloid. The lever arm stays across the ulna and along the 5th metacarpal, and I'm going to ask you to flex. And right there we're at about 75 degrees of flexion. Now we're going to check extension and make sure it's all lined up the same. Now extend. Right there we're at about 60 degrees of extension. The norms for flexion and extension, flexion 80 degrees and extension is about 70 degrees. And now we're going to check for ulnar deviation and radial deviation. And here you're going to put the axis on the capitate. You're going to align the lever arm to the middle finger and the other lever arm along the middle of their arm. Now I want you to ulnar deviate. There you go. That's about 25 degrees of ulnar deviation. And radial deviate. And that is about 16 degrees of radial deviation. Radial deviation norms are 20 degrees and ulnar deviation is about 30 degrees. Now we're going to measure the flexion, extension, abduction, and adduction of the thumb. Those go as extension, flexion, abduction, and adduction. Alright, CMC joint, you're going to place your axis right at the CMC joint, and then you're going to line your lever arm up alongside the radius, and then can I get you to extend? And right there, we're right around 18 degrees extension. Can I ask you to flex? And right there, we're right at 15 degrees flexion. Now we're going to measure abduction and adduction. Alright, now we're going to measure abduction and adduction of the CMC joint. Alright, once again, place the axis right on the CMC joint. The stationary lever arm, leave it along the second finger, and then place the other lever arm, the moving lever arm, along the middle aspect of the thumb. Alright, can I ask you to abduct? Right there, we're right about 65 degrees of abduction and adduct, and that's usually going to be about 0 degrees. Norms for abduction and adduction are abduction 70 degrees and adduction 0 degrees. Alright, now we're going to measure flexion and extension of the MCP joint of the thumb. And that's this one, and it allows for bending and extension of the thumb at the knuckle. Alright, can I ask you to flex this guy? Alright, that's right at 48 degrees flexion. Norm is 50 degrees. Now extend, and that's 0. And that is also the norm. Alright, now we're going to measure flexion and extension of the IP joint. And to measure flexion, can I ask you to flex? That measurement's about 78 degrees. Now to extend, we're on the back side. Right there, it's about 19 degrees extension. Norms for that, flexion is about 80 degrees, so he's right along normal limits. And then extension is 20 degrees, so he's right about normal in there. Alright, now we're going to look at the range of motions of the finger. First we're going to start with the MCP joint. We're going to start with flexion. And the norm for that's about 90 degrees, and he's right around normal range. Now we're going to work on extension. And the norm for that is about 45 degrees, and he's getting about 42 degrees. Alright, now we're going to look at the PIP joint. Flexion of the PIP joint, normal range is about 100 degrees. We're at about 95 degrees flexion. Can I get you to extend it? Extension's about 0 degrees on the average person, and he's got a little more than 0. So I'm gonna measure it like this. It's about 10 degrees. And next we'll go to the DIP. Extension of the DIP is also 0, normal limits, and his is about right at 4 or 5 degrees. And flexion of the DIP joint is about 90 degrees, and he's getting about 84 degrees. Alright, now we're going to look at manual muscle testing. You're going to test the strength of flexion within the wrist, extension, ulnar and radial deviation, and then flexion and extension of all the joints within the hand. So your MCP, PIP, DIP, and also the IP, CMC, and MCP of the thumb. So first, you're going to test them against gravity to check and make sure that, one, they can move it, and against gravity that gives them normal range of motion. That's a 3. If you do that, you eliminate having to go through 1 and 2 and 5 and 4 if they're unable. So first, for flexion, I'm going to turn his wrist around. I'm going to ask him just to curl his wrist. If he can do that, he's elicited at least a 3, and then we can move on to 4 and 5. So push against my hand, and that would be a 5. So he's got full strength and full range of motion. No breaks within it. Now we'll do extension. Okay, he's got a 5 on that as well. Radial deviation, there you go. There we go. And I skipped 3 because I knew he was perfectly fine. Now we're going to go to his CMC joint. So I want you to raise your thumb up. Okay. Now turn your hand around this way, and then flex it and move it this way. There you go. And that proves he can do it against gravity. Now we'll add some resistance. Alright, push, extend. There you go. Now I'll flex. And he's got a perfect 5 on that as well. Now we're going to go to the MCP joint of the thumb. Okay. Raise your thumb like you're hitchhiking. Perfect. Alright, point it down and pull it up. There you go. Push up, down. Now we're going to move on to the DIP, or the IP joint of the thumb. And so just raise this, and turn it down, flex it. There you go. He's got at least a 3. Now bend this right here, extend. There you go. Now flex. Perfect. Now we're going to move on to the MCP joint of the finger. Alright, can you set it here and now extend it? There you go. I'll turn it up. Now flex it. Perfect. Turn it over. Now we're going to do this against resistance. Push up. There you go. Now push up. There you go. Now we're going to do the PIP joint. So you're going to stabilize. Now extend. Flex. There you go. And you're going to want to make sure that you keep it right along this phalanx so that they can't utilize their DIP joint as well. Now I'm going to stabilize here. I'm going to ask them to flex. There you go. Now extend. There you go. Alright, now we're going to go over the carpal compression test. This is a test for carpal tunnel syndrome. The patient will express positive sign with numbness, burning, tingling. You're going to place one thumb right around where the capitate would be, and you're going to apply pressure with one thumb, then a second thumb. You're going to hold this for about 30 seconds. If they experience numbness, burning, or tingling, we're looking at carpal tunnel syndrome. Applying this compression to the median nerve is what elicits it. And you're just going to hold it for 30 seconds to about 2 minutes. Now we're going to do the TFCC grind test, so the triangular fibrocartilage complex test. We're going to place our hands on the distal part of the radius and ulna, and then grab the metacarpals. Then we're going to apply axial loading to it, and then we're going to rotate towards the ulna and then back this way. Pain, crepitus, clicking are all signs of weakness of the TFCC and also looseness of the TFCC. Now we're going to see the supination lift test. It's a test for the TFCC. All you're going to instruct your patient to do is place their hands underneath the table and lift. Pain along the ulnar side is indicative of TFCC tear or weakness. Alright, now we're going to perform the valgus and varus stress test. First, the valgus stress test. It tests the ulnar collateral ligament. Remember to keep your patient in the anatomical position. So, the valgus stress is going to test the ulnar collateral ligament, instability, and looseness during this motion is going to be indicative of ulnar collateral ligament damage. Now we're going to turn it around. The radial collateral ligament, apply a varus stress, and looseness, immobility, and pain are all indicative of radial collateral ligament damage. Now we're going to perform the Fallon's test. This is a test for carpal tunnel syndrome. You're going to have the patient place both of the dorsal aspects of their hands together and hold this for 30 to 60 seconds. Pain, numbness, tingling, and sensation or loss of sensation within the fingertips and hand, particularly along the medial aspect, are all going to be indicative of carpal tunnel syndrome.